When can we reopen the country, and what would our new normal look like? Dr. Anthony Fauci says we could see an antibody test soon, which could detect immunity. How effective are those tests, and how soon will the FDA commissioner approve them for use? FDA Commissioner Dr. Stephen Hahn joins us now. Good morning, Dr. Hahn. I want to start with the latest models, which are projecting that the U.S. peak in terms of daily deaths would likely be today. The president citing models that he said show Easter as hitting the top of the curve and then starting to come down. Have we peaked, and does this mean the worst may have passed?
Martha, thank you for having me on the show. The models do show that we are very close to the peak, and so I think that information is accurate. This has been a very fast-moving outbreak, and so we really have to take this day by day. We have some of the best experts in the world, Dr. Fauci, Dr. Birx on this, and so I think that information is accurate. But again, we have to take this day by day as the data come in, because this has to be a data-driven approach.
And of course, the president had initially set today as a target date for reopening the country. He backed off of that. But there are new warning signs about opening the country even by May 1st. The New York Times obtained new federal projections showing a spike in infections if restrictions are lifted. And the model the White House often cites predicts a death toll of 60,000 only if full social distancing is kept in place through the end of May. So wouldn't we be taking a big risk relaxing those measures now?
Those are obviously the issues that are going into the assessment of when is the right time to go back. Martha, I think the public safety and the welfare of the American people has to come first. That's been the constant message from the president, the vice president, and within the task force itself. So that has to ultimately drive these decisions. There are obviously other considerations. I've heard from friends and colleagues around the world that people really do want to get back to a more normal life than what we've had the last several weeks. But we've got to get the data as they come in. We have to look at what we know about this illness, what's happened in other countries, and put them into the situation, to the plan moving forward.
So given what you know, sorry, sir. Given what you know, is May 1st a good target when you look at it now?
Martha, it is a target, and obviously we're hopeful about that target, but I think it's just too early to be able to tell that. We see light at the end of the tunnel. Dr. Fauci, Dr. Birx have said that. We see the incredible resiliency of the American people with respect to social distancing, hand washing, and all those mitigation factors. So that gives me great hope. But I think it's just too early for us to say whether May 1st is that date. But more to come on that as we learn more information and as our planning proceeds.
And on Thursday, the president suggested widespread testing isn't necessary. And here's what he said about sending people back to work in states with lower density.
There's not a lot of issues with testing. Certain sections of if we go to Iowa, we go to Nebraska, they're very, very capable states, and they're big distances, a lot of land, a lot of opening. You don't need testing there.
More than 2/3 of rural counties have confirmed cases. So how can Americans safely return to work without a nationwide testing system?
Martha, there are a lot of factors that will go into this. One is the geographic location, the number of tests, the number of people who've been infected. If you look at the testing where it is right now, the strategic approach has been to focus that testing in the hotspot areas where if people come forward and are sick, as many as 30 to 40% test positive, whereas in other areas where there aren't a lot of sick people, and some of those are rural areas, it's less than 5%. So our strategy moving forward for opening up the country has to take all of those factors into account. And yes, further ramping up testing, both diagnostic as well as the antibody test, will really be necessary as we move beyond May and into the summer months and then into the fall.
Why, when other countries like the UK, Germany, South Korea have been able to do testing of millions of people, are we still so far behind? It was over a week ago that the Abbott test, a rapid test, was FDA approved. It is still not in widespread use. This is preventing people from going back to work, getting out of quarantine. When exactly will it be available in every major city in the U.S.?
So, Martha, this is a pretty complicated situation and it's rapidly moving. And that's not to suggest anything other than there's certainly pressure on the supply chain in terms of getting supplies. We have heard, and I personally have heard from people on the ground, that in some areas it's very easy to get a test and in other areas not. And we have to really, as a whole of U.S. government approach, have to make sure that we get those testing to the areas that need them. And again, it's been a strategic approach. Dr. Birx, Dr. Fauci in the podium on Friday mentioned that we've done over 2 million tests, which is more than any other country. Now, we need to do more, no question about that.
And I want to get to those antibody tests. Dr. Fauci said we're just days away from being able to use antibody tests, which can detect whether somebody has already been exposed to it and may have immunity. Do you expect the FDA to validate those tests for use in the coming days? And how fast will they get out there?
So FDA has already authorized one antibody test. There are a number that are on the market that we haven't validated, that we haven't looked at those data. There is a U.S. government effort to look at some of those tests and to be able to allow that validation to occur. But we do expect, Dr. Fauci's right, the team has talked about this. We're working with a number of really good manufacturers. They've come forward with their platforms. And so we do expect that relatively soon. Again, this is dependent upon the data and the science because it's got to be that decision. And Martha, just to put a point on this, we've seen reports, other countries, some of the countries you mentioned, that have obtained antibody tests that aren't accurate. And I think it's really important for the American people to know that we need tests that are accurate, reliable, and reproducible. That's what FDA does in a science and data-driven way.
And if someone does have these antibodies, do you believe they can safely return to work? Is this really the key, these antibody tests, of getting this country on its feet again?
It's one of the keys, and I think as both Dr. Birx and Dr. Fauci said at the podium on Friday, it's one of the factors that'll go into this, including the underlying characteristics of the person, whether they're more susceptible to a more serious outcome from COVID-19, where they live, what the prevalence of the disease is in the environment, and whether they've had a diagnostic test that's positive previously or not. So all of those factors will go into it. And including whether you have antibodies, because that should be protective, as you point out.